It's time we start to focus on the men for this women's health focused podcast festival. And I know what you're thinking. You're thinking, Kelsey, they sneak their way into everything. But trust me, you are definitely going to want to hear this because today we're going to be talking about how a man's fertility affects your pregnancy journey, your pregnancy symptoms, and the health of your child. Welcome back to Wellness Fixes the Pod. I'm your host, Dr. Kelsey Vick, a board certified orthopedic doctor of physical therapy and a pelvic floor physical therapist. And throughout this month of May, this month of mothers, we've been hosting a women's health focused podcast festival through the lens of pregnancy and postpartum. We've been learning all about the cool things that our bodies can do as women, but in almost one of the most important phases of our life of pregnancy and postpartum. So we've chatted about exercise during each trimesters. We've chatted about sex. We've chatted about creatine during pregnancy and postpartum. We've chatted about breastfeeding and all of the cool things that our body goes through. But there's a whole other side to that equation that we're not necessarily covering. And I really wanted to cover it in this podcast festival because it's going to be one of those topics that we start to hear more and more about. I'm already starting to hear more and more about it, which is why I wanted to dive into the research today and actually cover male fertility and, more importantly, how it really takes two to tango. We've been focusing on women during this pregnancy and postpartum journey, and our bodies as women do such amazing things, but our pregnancy journey, the health of our child, the health of our family does come down to another person, and that is the male contributor to that fertilization. So I wanted to talk about male fertility today and really cover it from this perspective of what can we encourage the men in our lives to do to help their fertility, because I also feel like they're a little bit forgotten about in the fertility space. But again, it takes two to tango, and we need to make sure that we're looking at both sides of the equation in order to really understand the full picture. So research has shown that the man actually does contribute obviously to the child, but specifically fetal development, pregnancy symptoms, a child's long-term health, possibly how a mom feels during pregnancy, and some of the health conditions she might get during pregnancy. Previously, research has focused more on those maternal factors, but I really do want to focus on the paternal factors today so that we can get a better idea of how to help ourselves, but then also help the men in our lives if fertility is a concern for them or a concern for us as a family. So today we're going to dive into the research together. A little bit of a disclaimer before we start. This will be talking about some scary things. A lot of the time we're focusing on things that might lead to complications, right? And so that is where the start of this chat is going to go, just so we can understand the link between what is happening with the paternal health that is going to affect the child and the maternal health. So I don't want it to be super scary. I actually debated on sharing some of these facts based on research, but I realized that being informed and educated is more important than sheltering the scary facts. So please bear with me. I promise I'm going to try and explain why this might happen and why some of these factors are the way that they are, but it is a little bit scary. So if you're not in the right headspace, if you are someone undergoing fertility challenges or struggles, or just, not in the right headspace to hear about this kind of thing, then I recommend probably skipping this episode. I'll leave chapters below. That way, if there are chapters that you do feel like you're in the right headspace for, you can fast forward through those. But I just wanted to give that warning because even as I was researching, I was like, gosh, this episode could definitely turn into something that is very scary and not this sort of positive podcast health festival that I want to bring to you guys. But it's the important stuff. And I realized this education might not be as widespread as, say, a woman's health or maternal health education when it comes to pregnancy and postpartum. So a few stats for you before we dive into the research. We're going to be looking a lot at the paternal weight. So overweight and obese are two separate categories, and the research pretty much ranks them based on BMI. And I don't know if we've talked about BMI on this podcast before, but it's not the best indicator, but it's a great standard indicator. So that's what we're going to use today. So the cutoff for overweight men, or overweight in general, and again, they do vary male to female, but overweight in men is 25 to 29.9 BMI. And I'll leave a BMI calculator below, but it is basically takes the weight divided by height in meters squared. Obese men have a BMI of 30 or more. So that'll be those cutoffs that we talk about. And so I'll leave that BMI calculator below if you're like, oh, hang on, does someone I love possibly fall in that range? So overweight men, again, that BMI of 25 to 29.9, are 11% more likely than their normal weight counterparts to produce low numbers of sperm and 39% more likely to produce no sperm at all. Obese men, again, that BMI of 30 or more, are 42% more likely to have a low sperm count, 81% more likely to produce no sperm. Paternal obesity actually leads to decreased pregnancy rates, an increase in pregnancy loss in couples undergoing things like IVF or assisted reproduction in some way, and there's an increased oxidative stress on the sperm, which can lead to morphological changes. This next one is hard to tease out. They've done it in animal models, but I figured I'd give you guys the stat anyways. Obese men are more likely to parent obese children. Again, humans, it's hard to separate because there might be multiple external environmental factors that are leading to that, but in animal models, it's a lot easier to tease out. And it has been shown that there are changes in metabolic function in offspring, biased more towards a negative impact on female offspring, actually, when controlling for environmental factors with paternal obesity. So in the offspring, they have been able to tease out all of the other factors that might go into play and show that paternal obesity can lead to negative health outcomes and negative metabolic function in the offspring with a more negative bias towards female offspring. With obese and overweight men and controlled for a healthy BMI in a female, there is a longer time to conception. There's been a lot of research done on how paternal factors can influence preeclampsia. And preeclampsia is high blood pressure during pregnancy in the female, and it relates back to hypoxia or decreased oxygen within the placenta. So there's a lot of factors from the paternal side that can feed into the maternal diagnosis and the maternal signs of preeclampsia. The chance of preeclampsia in the female was significantly higher with paternal obesity compared to normal BMI. As paternal BMI increases, the rate of preeclampsia increases. 13 to 19% of the development of preeclampsia can be attributed to the male. So a lot of the time there are male and female, maternal and paternal factors that go into this, but they have been starting to try and tease out, okay, if we control for these factors in the mom, what is coming from the paternal factors? This one was interesting to me, but men and women, both who were born from mothers with preeclampsia, have an increased risk for the female partner developing preeclampsia. And maternal and paternal obesity is a risk factor for preeclampsia. So we're focusing on the paternal health factors, but a lot of these that we'll talk about today are also mirrored for the maternal health profile as well. So maternal obesity and paternal obesity are also risk factors for preeclampsia. We'll focus a lot on that obesity part today and that overweight part today, but I did want to give a few more stats. And these, it's hard to understand why, but I figured they're good stats to have and just understand what all, besides even body composition, feeds into how healthy a pregnancy is, how likely you are to conceive, and then how healthy your child is later on. So older fathers, and this was a meta-analysis, I believe, which combines a whole bunch of studies. And so they said older fathers was over 35-ish. So it's hard to standardize that across multiple studies in this grouped analysis, but over 35-ish. Babies are at an increased risk for low birth weight, seizures, and a need for ventilation immediately after delivery. Although there was a disclaimer on this study too, where it was relatively low percentages of increase for those. So it was when you started getting to that 40, 45 range, but 35 did seem to be where that cutoff was. And so that's where they marked it. All types of parental smoking were associated with the risk of congenital heart defects. So there was an increase in 74% for men smoking, an increase in 124% for women experiencing secondhand smoke, most likely from their partner throughout their pregnancy. And there was an increase in 25% for women smoking during pregnancy. So what was interesting here is that there was a higher percentage for congenital heart defects in women who experienced secondhand smoke from, again, they estimated that most of it was coming from their partner or whoever they were living with. And there was even less of a chance of congenital heart defects with women who were smoking during pregnancy. And that risk decreased significantly if the woman stopped smoking before pregnancy, which I thought was very interesting. When they controlled for maternal factors, less paternal education increased the chance for preterm birth, low birth weight, and small for gestational age. However, maternal education offset the difference for small gestational age slightly. So there was this interplay and these effects between both where if maternal education was higher, it could offset some of the paternal education. Paternal race and ethnicity was associated with increased chance for preterm birth, low birth weight, small for gestational age, and high birth weight. And paternal race and ethnicity were primarily minorities, so Hispanic, non-Hispanic Black, and non-Hispanic others, which I feel like this is important to share because this is one of those things that the more education we have on this subject, there's so many variables that go into play. And I have a few friends that I'd like to bring on to chat about this topic specifically and maternal health discrepancies and paternal health discrepancies, primarily for minorities. But I think the more that we are able to understand this, the more we're able to advocate for ourselves. And advocacy is just one part of the puzzle, right? But the more that we can increase that and understand that race and ethnicity does play a role in some of these factors, the more that we can advocate for ourselves when we are undergoing this like pregnancy postpartum journey with our partner and trying to get the best healthcare for ourselves and advocate for ourselves in the best way possible in order to better help the baby too. So let's talk about the basics of male fertility. And we're not going to go over male reproductive anatomy or anything like that. Although if you want to learn more about that, definitely let me know because we cover that a good amount when we talk about pelvic floor health and just like physical therapy in general. But we'll talk about it today from a high level perspective. There's basically a few check marks that we want to check off to say, okay, these are some good qualities to have in order to maximize our chances for a healthy fertilization. And a lot of it comes down to sperm production, sperm quality, and sperm motility, or the ability of the sperm to swim. So with sperm production, we can have too little or none at all. With sperm quality, a lot of the time it's an abnormal shape or an abnormal DNA structure. They called it a lot fragmented DNA within the research. So just think about something glitching within the sperm. And then sperm motility, which is difficulty swimming. And there's a lot of things that can affect these variables, and a lot of the variables affect a lot of the different things in our life. So things like genetics, hormones, and then also lifestyle factors. So we'll zoom in a lot today on lifestyle factors and hormonal factors a little bit too, because those feed into each other a little bit. But genetic factors we've touched on today, those are a little harder to change. And so there's a lot of fertility issues and fertility complications that do come from genetics, and those are a completely separate category. Same thing with genetics for the maternal health, right? There's certain things that we can't necessarily alter. So today we'll zoom in on the things that we can actually adapt and change and help out with. So how does obesity and being overweight lead to poor outcomes and poor sperm production, quality, and motility? So we'll start from a hormonal perspective, but as body fat increases, leptin production rises. And leptin is the hormone associated with satiety, so it tells us when we're full. Leptin reduces testosterone production. Fat cells can also reduce levels of testosterone directly by turning it into estrogen. So from both standpoints, fat cells can themselves directly affect testosterone, but then it can also indirectly affect testosterone due to the increased levels of leptin within our systems. Testosterone is needed for spermatogenesis, which is that production of sperm. So if we put it all together, obese men with higher levels of leptin have lower testosterone levels, which impairs sperm production. And the fat cells themselves act as little bitty transformers of testosterone into estrogen, which again helps to lower testosterone and impairs sperm production. The next mechanism this can happen by, I'm calling this scrotal sauna, but body fat is like adding more steam to the sauna. And every inch of belly fat increases scrotal temps by 1.5 degrees Celsius. So an increased temperature in the male reproductive organs, so that scrotal sauna, can impair sperm production. That's why a lot of the time we hear no hot tubs if you are trying to get pregnant. So this plays into that too. Fat accumulation also increases oxidative stress due to the inflammation within the body. So it can affect sperm morphology, like mutations within the sperm, fragmented DNA, and it can also affect the ability of the sperm to get to where it needs. So its motility or ability to swim. And lastly, we have the master manipulators. So I was trying to think of a metaphor to link this to, but have you ever wanted to not show up to a party, but you have that one friend who is, come on, just come to the party with me. And you're like, fine, I'll go. So that's what happens to men's hormones with increased body fat. With more fat, there's an increase in the enzyme or the manipulative friend that tries to get you to go to that party that transitions testosterone into estrogen. It's called aromatase. It's aromatase activity, but it tries to get you to go to that party. It tries to switch testosterone to estrogen, which is going to impair sperm production. So with obesity, there is a 50 to 100% increase in this enzyme aromatase activity. In other words, the friend becomes more and more manipulative, the more people it can get on board. So obviously there needs to be a lot more research in this field and what can actually be correlated to what, because there are two factors or two people that go into fertilization. And so looking at both and better understanding what can contribute to both can really help the successful outcomes of fertilization, pregnancy, but then also the health of mom and baby and dad, right? So there needs to be a lot more research in this area, but I think it will be so interesting to learn more and more. And I think there will be a bigger emphasis on how can the man affect his health and positively affect his health in order to help the outcomes of the mom and the baby. So now it's time for a sperm glow up. There is research and there has been research done on how men can actually improve their sperm quality, improve their sperm production, improve their sperm motility in order to help with fertilization and healthy pregnancies. So that's the fun part because it's actually the actionable part that we can help with. So the reversibility of paternal obesity, so talking about that weight aspect, the reversal of that can positively affect fertility. And there are studies that show exercise, diet changes, and GLP-1 agonists or a combo of those are effective at helping to reduce obesity, reduce that amount of body fat percentage in order to positively affect fertility. There was a study done that showed significant caloric restriction and significant weight loss really improved sperm counts by 40%. However, this was an 800 calorie diet, which is not healthy. So again, there just needs to be more and more research in the field, but it has been shown that it can reverse the effects that increased fat percentage and obesity plays on a pregnancy and the chances of conception. Regular exercise can also improve sperm count and motility in overweight and obese men. So they recommend 30 to 60 minutes, 3 to 5 times a week of a moderate intensity. They typically bias that out to moderate intensity. And I'm not quite sure if exercise intensity has a role to play in that scrotal sauna or heating up the body to where the chances decrease, but they did specify moderate intensity. So what are some things that kill sperm or things that we should completely cut out of the system if our goal is pregnancy? Vaping and smoking, that one's definitely evident, if not only for the paternal health, but also for the secondhand smoke that the mom might experience. Heat and hot tubs, unhealthy amounts of body fat, again, in those overweight and obese categories. Pesticides and microplastics, alcohol, processed foods, and stress. Lower stress because that kills sperm. Always easier said than done. So what can we add in order to really show some love to the sperm? They love creatine. And we talked about this in Dr. Stacy's episode. They actually have a specialized creatine transporter only on sperm. So I'll link that episode below if you're curious about it. We talked about it briefly, but it was super interesting to learn. They love healthy body fat percentage. For food, in order to improve sperm concentration and motility, they recommend leafy greens, berries, nuts, and beans. And in order to improve sperm morphology and the forward motility of sperm, oily fish. And then in order to improve just sperm motility, tomatoes. So all of those foods, probably a combination of all of them, can really help. There was a study also done on acupuncture helping sperm, and then consistent moderate exercise. Again, I think that comes down to more of the heat that we don't necessarily want in the male reproductive organs above baseline in order to improve the chances of conception. So I'll leave all of the links, all of the research articles, all of the information below. I'll leave the BMI calculator just because we mentioned overweight and obesity a lot today. And sometimes it helps to have that objective measure. But I loved researching this episode. It's been something I've been very curious about just because I've been hearing more and more about it. It's been getting sprinkled into some of the conversations that I've been having, some of the things that I've been reading. So I figured it was time to do a deep dive today and figure out, what does the research actually say? Are they human models? Are they animal models? Where are we getting some of this information from? And what is the truth and science of how paternal health can affect maternal health and then also the health of the babies? I hope you enjoyed this episode. I hope you learned a lot. Send it to whoever you think might benefit from it, especially if you guys are looking to get pregnant and you are wondering, I'm doing all that I can, but what can my partner also do? So I hope this episode helped. I hope you enjoyed it. I hope you learned a lot. And I'll see you guys again on the next episode of Wellness Big Sis the Pod.